Good afternoon, everybody. This is Kate Tingley, Director of Marketing here at Infinix. Thank you so much for joining us. We're going to go ahead and get started. This week, I am joined for office hours by Liya Gehler, who is our Director of Product, focusing on the patient access side of products here at Infinix. And today we're going to dive in and explore ways to leverage technology in order to improve revenue cycle efficiency. So we're going to start today just by defining some technology terms. We hear a lot of terms thrown around right now, and I think for a lot of folks it can be overwhelming, and just understanding how that applies to healthcare, how that applies to the revenue cycle. So to start with, we're going to go through a couple of these terms that we're hearing a lot of and give some more examples on where we're seeing those in terms of revenue cycles. So, Liya, can you tell us what AI is?
AI is the process of educating a computer model using a complex data sets. The computer then learns the data from the training process to build its ability to make decisions or predictions. It can predict outcomes and present the new data, so then decisions can be made faster. So basically, the more data we have, the more accurate the predictions will be. It learns the behavior on the back end of it. So having a computer data that leverages thousands or more data points from payers and providers or whatever industry we're in, right? It leverages in many industries, and I'm sure you guys have some type of familiarity outside of it. So what works best based on the conditions, basically. So the AI helps form a structure from the data that we have, and helps take that data and then take that history and then predict the outcome in the future, right? Like if we know an outcome, if we input something and then, for example, you put, it's very simple, but you put carrots and an apple in the juicer, and then you have juice. So it's kind of like predicted outcome. So that's how it kind of works in a very, very simplistic form. So the AI model works based on the information that we collecting, that is being set and worked the data to split out results based on the matching previous behaviors. It is faster than human inputting all that information and then collecting that data. And it also takes the human error out of the equation. And as we all know, in the healthcare industry, time is very scarce. Resources and bandwidth of work are low. And it allows the practitioner, it allows the office to focus on human time in the best way possible. So the AI stands for artificial intelligence, as I was saying, and it refers to systems or machines that mimic human intelligence to perform tasks, and it can iterate and improve themselves based on the information that they collect. So the AI manifests in a number of forms. So for example, we have some chat bots that we can implement into the system to understand customer problems faster and provide more efficient answers, right? Like when you're calling someplace and you have automated voice system, they know, like, you want to pay your bill, you want to talk to a representative, you want to, there is functions that we already know how to direct within the systems. And then we have another example, we have intelligence assistants using AI to parse critical information from large free text database to improve scheduling as well. So the complexity and rise of data in healthcare means that artificial intelligence will really increasingly be applied within the field. So that's kind of like in a nutshell what is AI. So the big picture is it's an umbrella of different techniques and different science back ends that use in data to produce predictable results.
Great. Let's jump into machine learning.
So machine learning application, it improves the use and become more accurate the more data we have access to. Applications of machine learning are all around us, right? In our home, our shopping cart. You probably guys know the Alexa, like if you shop this, like they will remember what you did before, your previous behavior, and it will give you that outcome, you will see it, and then it's basically learning and then streamlining your behavior to make the outcome for you way faster. We also have it in shopping carts, entertainment media. You guys can see it in Netflix, in Hulu, all those streaming media types, and of course, healthcare. I want to kind of pinpoint and say, why is machine learning important? So machine learning is important because it gives us, it gives the enterprises a view of trend in customer behavior and business operational patterns, as well as support the development of new products. So as we learn more and more behavior, we can streamline, and then we can take that behavior and then layer another feature maybe in a product, or see how we can make that workflow easier. It kind of reveals gaps and behavioral patterns too. So the classic machine learning is often categorized by how an algorithm is learned to become more accurate in its predictions. So there are basically 4 approaches. I'm not going to dive into them. I'm just going to mention what they are. There is a supervised learning, then an unsupervised learning, semi-supervised learning, and reinforcement learning. So the type of algorithm data scientists choose to use depends on what type of data they want to predict, and it's also what data they have to work with. So there are basically 5 steps to this process of machine learning. So first of all, they identify the relevant data sets and prepare them for analysis. So they take all the data, they clean it up, they see what is usable, what is not usable. They choose the type of machine learning algorithm to use. They build an analytical model based on the chosen algorithm, and then it trains that model and then test the data sets and revising it as needed. They see like what is working, what is not working, how we can streamline or use less data to predict. And then it runs that model to generate scores and other findings.
Awesome, thanks. And the last term we're going to cover today is RPA.
All right, so RPA, as I said before, it's one of the components of the AI umbrella. So this technology performs structured digital tasks and administrative purposes. For example, those involving information systems, as if they were human using the following script of rules, right? So it basically mimics the behavior of the user while they're using an administrative software, right? You logged in, you clicked here, and then you click there. So think about it as a decision tree, right? There is different outcomes. You say yes to this, it brings you to another window. You say no to that, it brings you to a different one. And then it calculates on the back end what results going to be used. So a user is having a pattern of clicks and tasks that they perform, and the robotic process automation is basically matching those patterns. So yeah, I think the best way really to describe it is kind of thinking of the decision tree, as everybody knows, like you say no, you said yes, where it brings us. And then compared to other forms of AI, this component is really inexpensive and it's easy to program, and it's very transparent in its actions, because the human actions, usually it's not as complex. When you have a system, there is not 2,000 steps that you need to take. Usually it's very boxed in of what you can do with the platform or with a software or application. So the robotic process automation doesn't really involve robots. It's only think about it as a computer program on servers. It relies on a combination of workflow, business rules, and presentation layer integration with the information system to act like a semi-intelligent user of the system. So in healthcare, they're used to do repetitive tasks like prior authorization, updating patient records, or billing, for example. When we combine with other technologies like image recognition, they can also be used to extract data from. For example, you guys are very familiar with fax. And it's interesting because we still have fax today. And there is a lot of initiatives being done to kind of see how we can eliminate that, because it's such a painful process of submitting, waiting, and collecting all of that. So fax images in order to input it into transactional systems. So it takes the fax image and then it translates that data into a more workable form. So we described there are technologies as individual ones, but increasingly they're being combined and integrated. So robots are getting AI-based brains. Image recognition is being integrated with robotic process automation too. So where is RPA? So robotic process automation it's shortened to RPA. There's a lot of acronyms, as you guys know, in the healthcare space, where it can be used in the revenue cycle technology. So it can help business to automate manual revenue cycle processes, such as form creation and processing for authorization, eligibility checking, and claim adjustments. It allows users to complete those tasks in a fraction of the time and avoids possibility of human error and delays due to resource constraints.
Great, thanks so much for explaining all that. Where do you see most healthcare organizations are lacking from a revenue cycle technology standpoint?
I like this question, and I think like if you were to ask me this question a couple of years ago, I will have a different answer. But now I feel I see it through like a more bright, more colorful lens in a sense. I see that we are improving a lot in the last 2 years. We have we have the pandemic that started, right? And it's hard to find employees. It's if they're sick or they're working from home, right, they can do less tasks from home, and maybe the system is not as secure. So healthcare organizations starting to really take a major step into integrating technology and evolving. I think there is a partial also generational influence as well, right? Like the younger people coming on board, they're all technology natives. Everybody was born with a smartphone. Everybody knows how to use the internet. Everybody relies on that. It's not as scary as it used to be 20 years ago or 10 years ago even, with the older generation. So more people are using technology as an extension of themselves. So it's not scary. And it's all around us, right? We can start trusting it, trust the algorithms. It can replace mundane human tasks. So I feel like there is a lot of also around, I know it's cliche, but maybe like the millennial era, everybody's trying to find more purpose in their work. So instead of doing mundane tasks, now we can focus that effort and that work into more meaningful work that can accelerate the business. But yeah, many tasks can still be streamlined and performed in a fraction of time if we're using those technology in the right way, which in turn gives us the organization bandwidth to focus on the right things. I feel like some organizations are still scared, and I think it's very valid, right? Because the healthcare industry, we are still handling at the end of the day with health of people, and we need to be very cognizant, and people are very cognizant of technology and the failures of technology. We can have something happens and the systems are down, and then we can't do anything, and then we have a pile of patients waiting to be treated, and it takes a lot of time. So there is a lot of unfamiliarity maybe with the staff of like, I'm doing this way, how can that be done quicker? So there is this lack of, I will say, trust, and I feel like unless you using it, after you use it you can trust it, but if you haven't used it and you're still stuck in your ways, then that can I can see how it can be scary in that environment. And it's also giving up control, right? Like it's things we used to do. We know we're the expert in that, and suddenly technology takes away that piece.
I think there's also the assumption that technology will replace jobs, replace people.
Yes, and of course, I feel like there is a big fear around that, but I feel like with that, there is always something else that we can put the focus on that can build bigger results, right? Like if somebody is inputting in the form again, same information, maybe that person can be used to do the steps afterwards, right? To really help in the clinic, in the provider space, to really help more and help expand the business. It's really like taking those hurdles from the business. And also it's used in many ways. It's used from, if it's in an admin space, or if it's managing an office, or streamlining the revenue or collecting revenue, then you can really see, you can take that data and help you drive and find better ways of receiving revenue. So I feel like it's kind of unlocking the potential of the business.
That's a good point. And technology will never be able to fully replace. There's always going to be exceptions, and things are going to need that human touch from a revenue cycle side. So where do you think within the revenue cycle, if I'm a practice looking for easy wins to free up some of my office staff to do other things, where does it make sense to get started in terms of implementing new technology and replacing some of those manual processes?
It's interesting, right? Like, I feel like a really good way to start in that process is to have first, like, evaluate where the gaps are. Am I not collecting revenue here? Do I have a lot of denials? What is missing? What is the biggest hurdle to really know?
Right.
And how understand the internal work process that is being built, or knowing like, I don't have enough people to submit those claims. I don't have enough people to do X, Y, Z. Maybe some technology or some platform can do it. And I feel like a good way to start there is to have the right people in the room to have a conversation, right? Like, everybody's doing their own role, but knowing what the admin is experiencing, and knowing, for example, if somebody's doing the books, or if it's a bigger practice or hospital, if they have like a chief financial officer, so they're handling all the financials and they know where the gaps are. And we have the technology people, what technology is already being used, because you don't want to duplicate technologies, right? Like, if somebody's
Right.
filling out a certain a certain software, EHR, you want to make sure that the places you seek that solution, they have integrations. So if you have the integration, they don't need to go and log into a different space. And, because if you log into a different space, a lot of the information is going to be lost and the systems are not talking. So there is more tracking to do. So I feel like good place to start is to have a conversation, understanding all those elements, and then just going and seeking the solution, in a sense of going and having the right questions to ask, and then not being afraid to kind of like rip the band-aid, right? There's a lot of places, I know for Infonex, we're offering free trial in the beginning. So like, until you use it, you don't know how effective it's going to be, and clients see results really quickly on the bottom line, especially.
That's a really good point. So we talked a little bit about the impact of the pandemic, and a lot of those hardships right now are just around staffing challenges, whether it's, I read somewhere today that 9 million people were out sick with COVID. That's a significant number, on top of the fact that we're in the middle of this great resignation. It's a weird time for staffing. So what are some ways that folks can leverage technology to really help with these staffing challenges, so that they're not?
I feel like it's like a given question, Kate. It's an easy question.
Yeah.
Especially now, right? But I think it's like a free in the inertia of adoption of technology right now. It's because there is problems of staffing, because
right.
Or maybe there is challenges of collecting revenue, especially now more than ever. Right. A lot of people are sick. The bills are higher. Less people come into the office for regular visits. So technology it's a fraction of a human cost.
Right.
So that can fill out those gaps. So I think that's a perfect time to try it out.
It's a good point. Also, just taking a look at your manual processes and repetitive tasks that really technology can just take that over, freeing up the staff that you do have to focus on more complex stuff is also really important. But I think the time is now, right? Because this isn't changing. Hopefully COVID's on its way out, but certainly a lot of these staffing challenges are not going to resolve themselves overnight. So the time is now to take a look at technology and figuring out how to automate some of these processes. All right, last question for you, Liya. What advice do you have for organizations looking to implement new technology? Best practices, parting words of advice?
So having the right people in the room, examining
Right.
what workflows you guys have, seeing we're using this system, we're using that system, like what integrations do we have integration? Is it we're already working with the thing now? Maybe there is a solution there that can help us streamline and have access to more patient PAs, or and then having the people in the room that will give you answers, because I feel like a lot of times what I'm seeing from organizations, it's somebody's driving, right? Somebody's driven in an organization to make that change, but they're not communicating internally, and that process takes longer. So I feel like it's more painful for them, but it's everybody just gonna sit down and see like what the problem is, and everybody have a different set of problems. So just like writing it down and figuring out, and then just going and having demos, right? Like everybody can go and set up some time on companies' websites and having a quick demo, and then they can really show you what can be done for you.
I think also prioritizing integrations. Also, what is your system? What systems does any new technology need to integrate with? And asking those questions.
Yes,
from the
and
beginning.
we have a fatigue, right? We have like a software fatigue. Everybody has a cell phone, and we already have trillion applications. And if you need to log to that app or this website and that website, and especially at work, it's like you don't want to go and log in, and then you logged out, and then that affects your time, right? Like, oh, I forgot my password. I need to resend it into the day. It's like, no, you already have a system you're working with and you're relying on for your work. So if you can have an integration, I feel like that's the easiest way, and that will really increase adoption from internal staff as well.
It's a really good point. Any other questions anybody has before we wrap up today? All right, if no one else has any questions, as always, if questions come up after this call, don't hesitate to reach out to me. You all have my email address. Happy to get any of your questions answered. And we will hopefully see you all back here next week. Next week's topic, we are going to continue to talk about technology, but we are going to dive into best practices around technology implementation and onboarding. So you'll see an email come out about that soon, and we hope to see you there. Have a great night, everyone. Thanks, Liya, so much for all of your words of wisdom and advice. We appreciate you being on, and have a great evening, folks.
Thank you. Have a great night.
Thanks. Bye-bye.